Top health officials warning of a post-holiday surge after a record number of people traveled this weekend. Just look at the lines inside Logan Airport. Agents screened more than 1.2 million people yesterday alone. Meiler spoke with Dr. Dickson at UMass Memorial Health about how that travel volume could impact the coronavirus crisis in Massachusetts over the next few weeks.
I just wanted to get your input. I'm at Logan Airport this morning. There were lines here, busier than I've seen it this year, and I just wanted your input on seeing these travel numbers.
Yeah, very concerned to see the amount of travel that occurred during the Christmas holiday. It looks a lot like, and even a little bit worse than what we saw from Thanksgiving, and we're still dealing with the consequences of the Thanksgiving holiday. So this is very concerning.
Yeah, the TSA reported that there were 1.28, so almost 1.3 million people that passed through checkpoints across the country yesterday, and that was the highest since the beginning of the pandemic. So it does seem worse than Thanksgiving.
And we have not come down from Thanksgiving. We had about a 60% increase in our admissions and our positive test rate, and it is held at that level. So if Christmas is as bad as Thanksgiving, we're going to see a compounding of bad on top of bad, which is a really difficult situation. And then who knows with New Year's Eve what that will bring. So it's going to be a tough January no matter what in the state.
Based on the travel numbers that you're seeing, what are you concerned? What do you think you're going to start seeing and when?
Our biggest concern is hospital beds for patients that require oxygen or ventilation in the worst case scenario. And right now in central Massachusetts, we're just about where we were during the peak of the first peak. And so we have some additional capacity with the DCU field hospital and some ICU surge capacity, but it's going to be tough to manage another 50 or 60% increase. And I think for hospitals that don't have that extra surge capacity, it's going to be particularly hard.
I know that you have the DCU Field Center set up now as a field hospital. After seeing these numbers or in anticipation of these numbers, was there anything else that you guys were doing or can do to prepare?
Yeah, we have 200 beds in the field hospital, so we could manage another surge of 75%. The challenge is getting those beds staffed. And we build it for the worst case scenario and we hope for the best case scenario. The best case would be we didn't need it at all. We've already cared for about 150 patients in the field hospital. So it's a good thing that we put it up. It saved us hundreds and hundreds of bed days in our main hospitals, which are already quite full. So, the big challenge will be staffing. We'll have in week 4 of the vaccination, some staff getting their second vaccine. That's typically when people have reactions. So we may actually have people out with COVID symptoms just because of the vaccine. So we're a little bit concerned about next week in particular, when you have the second set of vaccinations coming on, staff potentially being out with that, as well as the post-Christmas surge. It's all adding up to, as I said, a very shaky first couple of weeks in January.
Are you frustrated?
Yes, at the same time, I understand that people want to see their loved ones during the Christmas holiday. But what we needed in healthcare was a bridge of about 3 to 4 weeks in between where we were and the vaccine starting to have a meaningful impact. And based on the travel numbers, it doesn't feel like we got that bridge that we needed. And, it was really, we're fighting a 3 to 4 week window of the vaccine really taking impact and us getting our hospital admissions down. But in the end, we'll do what we can to take great care of patients in the region and hopefully not run out of space and get into those crisis standards of care that we don't want to be implementing, but we do have them ready if necessary.
All right, Dr. Dickson, anything you want to add that I didn't ask you?
I just wanted to say thank you for all of the healthcare workers across the state that had to come in and work on Christmas Eve, Christmas Day, Hanukkah, Kwanzaa, whatever the holiday is that you celebrate. Thank you so much for giving up time with your family such that you could care for our patients.